Okay, so let's get started. Hey guys, nice to, uh, well, not really see you, but thank you for joining us and watching our resident virtual open house. We're really excited to hopefully meet all of you or some of you at our interview process later on in the year and early next year. My name's Abitha. I am one of our chief residents here at Northwestern. I want everyone to introduce themselves before we get started, but I'll just start and you guys can kind of go along with that same sort of a deal. Okay, so I'm from New Orleans and I went to Northwestern for undergrad, went back to LSU School of Medicine in New Orleans for medical school, and decided on ENT pretty early on. I had some really great research mentors in the pediatric ENT department that I kind of just randomly got connected with, and that started off my interest within ENT. Yeah, we really, I mean, honestly, it's just been, and since then it's been kind of a no-brainer for me. So I'm really excited to be in our currently in our ENT program. I did a sub-I here when I was a fourth year, and this was my top choice. I was very excited to come here, and I'm really excited that I am a resident here. Kind of sad that it's almost over. But yeah, so I'm doing a fellowship in pediatric ENT in Denver next year, and hopefully staying at an academic institution somewhere, but TBD for that. Karina, why don't you go ahead?
Hey guys, I'm Karina. I'm one of the current PGY4s. Originally from California, went to college in New York City at Columbia, and then went back to California to UCSF for med school, and now I'm here. I've been kind of interested in ENT since, similarly to Vitha, started with some research interest in head and neck, and super fascinated by the very cool anatomy, like everybody else is.
Mm-hmm.
And in terms of, it's crazy. I love this program, and it's amazing how fast like 4 years has really gone by, almost 4 years. And planning to go into general otolaryngology. Hopefully apply for jobs soon.
All right, why don't we have Paris and Sneha, then Nico introduce themselves. So we'll go by PGY year, so it's clear for you guys who we are.
All right, I'm Paris. I'm one of the third years here at Northwestern. I'm originally from Chicago. I went to undergrad at Southern Illinois University, Edwardsville, and then I went to Rush Medical School. In between undergrad and medical school, I did take a year off. I worked as a scribe in the ER, so never thought I'd be a surgeon. And then found ENT during my third year and am ecstatic that I'm in this field. I love it. I wouldn't trade it for anything. So.
Sneha, you're muted.
Oh, sorry. Hi, everyone. My name's Sneha. I'm one of the PGY2s. I'm originally from Holland, Michigan, which is on the opposite side of Lake Michigan as Chicago. And I went to Princeton for undergrad and then came to Northwestern for medical school. And I was thrilled to match here for residency and stay here for another 5 years. Going into medical school, I always knew that I potentially would want to go into a surgical field. I've always enjoyed doing hands-on things. And I found that ENT was a really good blend of both big and small procedures, adults, children. I loved the variety, and I really loved the attendings and residents who I had a chance to work with during my time as a medical student at Northwestern. And so decided to apply into ENT, and fortunately was able to stay here at Northwestern for residency.
Hey guys, my name's Nico. One of the first years. I'm from Bloomfield Hills, Michigan. Went to the University of Michigan for college and med school, and then found myself here at Northwestern, where I'm just about 5 months in now, which is already crazy, but it's been good so far. I got into ENT. I worked for the anatomy department at Michigan. Loved teaching, and then found myself teaching the dental head and neck anatomy course. Saw how interesting head and neck was. Started working with some ENT attendings, and just fun there. So happy to be here at Northwestern with with this great group.
Awesome. So we will kind of get into our discussion here. So the first sort of general topic I wanted to cover was just a kind of overview of the really different training sites. I think such a strength of our program is really the diversity of, patients and, pathology that we see, both Northwestern, Lurie Children's, and then at County. So Abita, if you could just give us in like broad strokes, kind of give us broad overview of the different sites and kind of what's unique about each one.
Sure, yeah. So I'll just kind of get the conversation started, and I think we can have everyone sort of jump in as we see fit. So we do, like Karina said, we have 3 different sites at which we rotate. Our main site is the Northwestern Memorial Hospital, which is this big, beautiful facility here in downtown Chicago. It's a block or 2, I think, away from the Magnificent Mile. If you've heard of Chicago, I'm sure you've heard of Chicago, but I'm sure you've heard of the Magnificent Mile and probably have been here at some point. So we spend the majority of our time here. We have 2 different services, which I think someone will get into at some point, but county is another rotation that we go to. We spend about a third of our residency there. So our county rotation, it's also known as the John Stroger Hospital now. That is about a 15-minute drive from us. It's located on the medical campus, sort of on the West Town kind of area of Chicago. And we spend 4 months there as a second year. We spend 8 months there as a 4th year, and 4 months there as a chief. And that also is a great opportunity. We have 2 different teams within the ENT rotation or department at County. One is actually run by UIC and one is run by Northwestern. We actually work pretty closely together in terms of call, and it's really great to be able to work with people from other institutions as well. And then speaking of working with UIC, we actually also work with UIC at our 3rd institution, which is Lurie Children's. Lurie Children's is a part of the Northwestern Memorial Hospital campus. It's its own freestanding hospital, but it's connected by a I believe it's like a bridgeway or something like that. So you don't have to go outside when it's really cold out, which is great. But yeah, so Lurie Children's, we spend 7 months, 1 month as an intern, 2 as a 2, and 4 months as a 3. We also rotate with the UIC service. At this point, like at Lurie Children's, we're all one big service. So we really do work in coordination with them pretty closely. And it's great because I feel like we not only work with our own residents, but we work with residents from other institutions as well. So I think that has been a very valuable experience.
Cool. So Sneha, I know you were just at Lurie, you just finished your 2nd year rotation there. I was wondering if you could, we're really lucky, I think, to be able to work at our freestanding children's hospital. I was hoping you could discuss a little bit more about the specifics of Lurie, sort of the structure, OR and clinic opportunities, touch on the kind of OR volume there and our interactions with faculty there.
Mm-hmm. Yeah, so as Abita mentioned, Lurie is a site that we rotate at for 2 months during our 2nd year and 4 months during 3rd year. During this rotation, you have the chance to work with the rest of the Lurie team, which is comprised of 2 fellows, a 3rd year from Northwestern, as well as myself, who was the 2nd year, and then the UIC residents. There's either 1 or 2 PGY3s from UIC who are also there. As a resident at Lurie, you are intimately involved in both the operative as well as post-op care of patients. As a 2, I got a lot of experience doing bread and butter cases like tubes and tonsils, as well as airway, doing DLs and bronchs on patients. But then you also have your fair share of soft tissue cases. I had the chance to do a couple cystrunks and be involved with pediatric thyroids and other head and neck congenital masses. So Lurie, as a tertiary referral center, gets patients from all over the region and really all over the country who are sent for complex airway needs, or as well as it's a huge head and neck site as well. And so we get a lot of experience with a variety of cases. You also work directly with an attending every week. So the model at Lurie is that there is an attending who is who's called the SOW person, which is the on-call attending of the week. And they basically, any case that's added on for the week, any consult that's operative, any new consult is staffed by that attending. And if they need to be taken to the OR, that attending is responsible for their care. And that attending also handles the inpatients. And so as a resident team, when we round with the fellows in the morning, we then run the list and staff everything with the attending, who is the SOW attending of the week and also sees the patients. I forgot to mention at Lurie, we also have a lot of support staff. One of the great benefits of being at such a busy pediatric site is that we have the help of PAs. There are inpatient PAs as well as several outpatient PAs who help with floor work as well as holding the pagers during the daytime. As I mentioned, Lurie is a pretty operatively heavy rotation for us. And so it's nice that when we're in the operating room, we have the help of PAs who hold the pagers and help handle floor work.
Sneha, if you could also comment, I know we had this conversation like a couple days ago about how much you appreciated the kind of call system where you felt like you worked very directly with an attending. Can you mention a little bit about like the attending resident relationship?
Mm-hmm, definitely. So at Lurie, you're really working one-on-one with attendings in the operating room because we usually have between 3 and 5 ORs going on any given day. You're usually one-on-one with attendings for cases. Also, when you take call at Lurie, you staff any consults directly with the attending. So as the junior resident, I think that at first it can be intimidating, but it definitely makes you, it really builds a lot of confidence because you really have to formulate your plan and talk to the attending about your plan directly and get, you know, you really feel like you're the one who's managing the patient's care and then directly talking to the attending about it. So we have a lot of one-on-one interaction with the attendings there.
Awesome. So I wanted to talk about county a little bit more in depth, our rotation at the John H. Stroger Hospital. I'm currently on my 8-month stretch there. So as Abitha mentioned, we do spend quite a bit of our overall time at county. It's a big part of our experience. We spend 4 months there in our second year, 8 total months in our 4th year. Half is an inpatient rotation, half is more of an outpatient rotation, which I can go a little bit more into. And then finally, 4 months as a chief there. I think I really love that county experience. And I think that's because it's one of the most challenging, rotations in some sense. You're really, serving a population that's underserved and has really complex advanced pathology, but I think part of that means that it can also be some of the most rewarding experiences. I think it's overall county has such a great combination of autonomy where you feel like such a great and personal ownership of patients. We do both OR and clinic at county. So in clinic, we're having preoperative discussions with patients, evaluating them for surgery. We'll take them to surgery and then follow them very closely in the hospital if they remain inpatient or postoperatively in our clinic. And I've never felt, I think I felt a great sense of, ownership and the ability to provide care in sort of in an autonomous fashion, but at the same time, I never feel that I'm without support if I have questions. Sort of the attendings are always happy to discuss the patients with you and see patients with you. And that's, never, I think, a concern. In terms of just more sort of just breaking down the rotation logistically, it's a clinic 3 times a week, and then OR usually 2 times a week. We do another really unique aspect of the county rotations that we run a multidisciplinary cancer clinic. I think providing comprehensive cancer care to underserved patients is one of the highlights of county for sure. We see them preoperatively in our clinic. We gather their sort of workup data and present that in a multidisciplinary tumor board, where I think it's amazing that we get input from all different specialties who are, and every individual in that tumor board is so invested in the patient's care, and it's really cool to see that sort of collaboration there. And another
the food, we have to mention the food. We get free food at county.
The most important.
Yes, which is definitely, and I mean, the chicken fingers there are amazing. So that alone is like a reason to come to this program. So that plus the unlimited number of awesome drinks that they have, like coffee drinks, Starbucks, Gatorades, protein shakes,
large turkey legs.
It's great. The food there is great, but we can move on to Paris talking about Northwestern.
Yeah, so at Northwestern, we have 2 services. We have the purple service, which is like our head and neck, laryngology service, sleep also. And then we have the white service, which is more of the outpatient surgery. So like rhinology, otology, and plastics. Is very heavy operatively. Purple service particularly has added a couple of new attendings. We have a sleep attending and another head and neck surgeon. So we now have 3 head and neck people. I'm really grateful for how much surgery that we actually get to do. I think, even as an intern or second year, you're really getting in there and actually being able to do cases. Like being able to do festas as a second year has been amazing. And then like being able to then go back to Lurie's as a third year and actually get to do the surgery, do the festas particularly, and the more complex head and neck cases. I'm very grateful for the operative experience that we get here for sure.
Also, again, I'm sorry, I don't mean to keep harping on the food, but Northwestern has 24-hour Starbucks, Dunkin' Donuts, Panera, and like so many food options here. It's basically like you are in a hospital, but also the most amazing food court that you will ever see. So definitely one of the things that's worth checking out here.
Yeah, for sure. And some of that food is free because of our freedom pay. So don't forget to mention that.
Absolutely. All right, so let's move on. Let's talk a little bit about, get into a little more detail about the PGY years. So I wanted to hear a little more about, the structure of the year. What types of surgeries do you feel like you do during the year? And, do you get clinic experience and any perceived highlights of the year so far? So let's start with Nico. I know that you're 5 months in, but I'd want to hear more about, the answers to these questions for the intern year.
Sure. Yeah. No, I mean, even just with like the shorter timeline, I feel like I'm starting to get a pretty good feel for like how things are, how things go here. It's been pretty sweet. So for our intern year, we do much like other ENT programs. We have 6 months of ENT, 6 of off service. The off service rotations we do here are, we do plastics, surg-onc. We have a month of night float. We do anesthesia, SICU, and then neurosurge. And the neurosurgery rotation is pretty cool. It includes a week of neuroradiology as well. So kind of getting a head start on, CTs, MRIs of the head and neck, which as we all know can be a bear. Just wanted to mention quickly the off-service rotations, even though you're not with your people and like the program that you joined, they're all like, I've had on the 3 that I've had so far, phenomenal experiences in terms of people being welcoming and getting you involved. And sure, there's times where you're doing stuff just on the floor, but on some rotations you're in the OR a lot and getting exposure. So it's not just a task that you have to get through. You actually learn a lot, and I think the rotations we have here are pretty well selected. For the 6 months of ENT that we get, so we do 2 months of outpatient. One is our like more otology, rhinology, and plastics. The other is an outpatient head and neck month. Then we have a month of peds at Lurie. just to kind of get a feel for it. You know, you get to do consults, you're in the OR, you're kind of all over, just learning, getting exposure to what you'll be doing during your second and third year. And then we have a 3-month block of our inpatient ENT on the purple service, which is kind of nice. You get 3 months in a row, lots of continuity, working with the same. Generally, you get to work with the same attendings over and over again, so they know like what level you're at and how much you can do. So I actually start that in December. I haven't done it quite yet, but speaking with my co-intern, Pucci, who was just on that, he had a phenomenal experience. So really looking forward to that. In terms of surgeries that I've gotten to do, I'll keep it brief, but you know, on my plastics rotation, we did tons of stitching, which was awesome, just to really get comfortable in the OR and making all your subcuticular deep dermals, getting them looking nice. And then they also do some craniofacial stuff, so we get some exposure there. On the ped side, you can get started doing tubes and tonsils. I got to do a few myself. And then, you know, on your outpatient months, you know, it is what it is. You're in clinic, but you get to help out with whatever procedures they do, which was a great experience.
Great, thank you. And just to let you guys know, Pucci is not a nickname. It is actually one of our residents' last names. In case anyone, yeah, exactly, just to clarify.
Just so used to calling him Pucci.
Sneha, why don't you tell us a little bit about second year? You know, what rotations do PGY2s do? What's their role? What types of cases do you do? What highlights have you had so far?
Mm-hmm. So as a second year, like I mentioned before, I've spent 2 months at Lurie already. I just started on the white service where I'll be spending the next 4 months. So white, like Nika mentioned, is our outpatient surgeries, mainly otology, rhinology, and facial plastics. And then you also do 4 months at county. So I have yet to do that rotation. So this year, like I mentioned at Lurie, you get a variety of cases: tubes, tonsils, trachs, airway, some soft tissue, head, neck. At Northwestern on the white service so far, it's only been a couple weeks, but I've gotten the chance to already be involved with a lot of sinus surgeries and really have gotten already in the 2 weeks like a lot of experience with doing fesses, septoplasties, TURBs, and on the facial plastic side, working with Dr. Thomas and Dr. Seidel, they have had a variety of cases as well: rhinoplasties, facelifts, a lot of cosmetic procedures. And I haven't had my otology experience yet, but Dr. Miko has been very busy as well. So I'm excited to get the otology experience this block.
Cool, thank you. And Paris, if you have anything you wanted to add about the PGY2 year, I know that Sneha has just started her white service and also has not gone to county before. So if you have any additional thoughts, feel free to chime in. But also we'd like to hear sort of the same answers for the PGY3 year. And I know your year is a little bit, it's not exactly how we've done it in the past, but if you could talk a little bit about how we typically have our rotations for PGY3, that'd be great.
Yeah, for sure. So I think Karina summed up the counter rotation pretty nicely. As a 2, you're really that main person who is in the pager, seeing the consults. But, you know, even though I felt very autonomous, I always felt supported by the attendings and by my chief residents. If I had any questions, I could always go to them. And I started off my second year doing that. And I think it really set the tone for the rest of second year. And I felt like I could conquer anything after being at county. So it's an amazing rotation. You learn a lot. In terms of PGY3 year, so it is set up where you do 4 months at Lurie, which I just finished, 4 months of research, and then 4 months of white service. So I am currently in the research block now. I know we talked a lot about Lurie's, so I'll talk more about research. It is a self-designed rotation, so there is a vast array of research that's going on both at NMH and at Lurie's. So you can really just reach out to anyone. Everyone is very receptive to, you know, just resident feedback and getting involved in projects. So there is guidance. There are certain requirements that you have to meet, different lectures that you have to give, but it's self-designed. So whatever research that you want to do, you can either start your own project or get on with someone else. And then we also do the white service. So having done that during my second year, I have some experience. And so I'm really looking forward to being a little bit more autonomous on that rotation during this year.
Awesome, thank you. Now that we're getting to PGY4, Karina, you want to talk a little bit about your experience as a fourth year? Yeah.
Yeah, this is like the first year as sort of a senior resident, and I think it's been great actually. Really, I think now that you are the resident surgeon for many of the cases, especially the ones I've like had in sort of head and neck surgery at County, which was my first rotation. Getting to be the sort of primary surgeon taken through by the attending for both the sort of resection part of large head and neck cases has been, I think, getting to hone my operative skills this year has really been a focus and a good one. In terms of just specifics about where we spend our PGY4 year, I can touch base on. For County is 8 months, so quite a good substantial portion of your PGY4 year. I just finished my 4 months on the inpatient block, as I mentioned, getting really involved as sort of the primary surgeon on a lot of the head and neck cases. And then I just started my 4 months on the outpatient rotation, and it's been really exciting because I get to book my own my own rhinology as well as otology cases, which we do about every other week at County. And having Dr. Miko actually take me through mostly the entirety of a lot of like this chronic ear cases has been really great, and I think it'll be very beneficial to being able to do these on my own in practice. And yeah, I think those are sort of the highlights.
Cool. I can talk a little bit about chief year. So I started off my chief year at County, and I'm sad to say that I'm done with my County rotation. I'm currently on the white service with Sneha, and we're doing otology, rhinology, and facial plastics cases like she talked about. And then I'll finish off on purple service doing the head and neck laryngology and sleep rotation. So chief year is very different from the rest of residency. It is really where, as you can imagine, your attendings kind of start to treat you like a junior attending. We really do experience that sort of shift in their trust in terms of really they put a lot of trust in the chiefs, and they expect us to run the service. And they're there for us as allies, and also as to be kind of sounding boards for our decision making. But otherwise, I really feel like there is a lot of autonomy, and we start to feel like we're actually able to make these decisions independently. Not only that, I think operating, everyone kind of talked a little bit about the different operative experiences that we do have. I would say early on in residency, we get very comfortable with pediatrics, laryngology, and rhinology cases. But then towards the end of our residency, so like Karina said, 4th year is when you really start to get very comfortable with both head and neck as well as otology cases. And then your 5th year, you start to get comfortable with you pretty much are comfortable with almost everything. And we are very much expected, I would say, to sort of run the operating room along with our attendings, and we do get they do take our feedback really well as well. I think I kind of feel like when I'm in the operating room with an attending, it's less of a, tell the attendings exactly telling me always, what to do and how to do things, unless I, obviously want that or need that. But a lot of it is kind of a conversation between the two of you about how to actually, complete the case. So that I think is very an important point to make about chief year. Otherwise, we help out with didactics, and we have a didactics program that we'll talk about a little bit later. We also do some administrative work. We kind of help recruitment like we're doing now. And yeah, I would say chief year is absolutely wonderful. I've really loved it. And, I'm starting to already feel nostalgic about this program and almost being done. It's kind of crazy to feel like it's 4.5 years have already gone by so quickly. But yeah, I think that's pretty much all I would add about PGY 5 year. I think we can move on to the next thing.
Yeah, so the next sort of big topic we'll talk about is call. Definitely, I think prioritizing your wellness as well as learning in residency is super important when thinking about where to go. So I was wondering if either of you could sort of touch on how call is at the different sites, junior versus chief call, et cetera.
Sure. Yeah. I might need a little help, like with some of you guys to chime in terms of like how frequently we're taking call as a junior. So at Northwestern, in general, we're taking about Q4 call. Is that correct? Q4, does that sound right, guys? Q4 call?
Yeah,
Okay.
average.
So yeah, on average, we take about Q4 every fourth night. We're taking call here as a junior. As a at county, we take about Q5 calls. So every fifth night, we basically split things up with the UIC team. So that really helps out with the call burden. And then at Lurie, depending on how many people are on the service, it's about Q3, Q4 call. And we do also have our mid-level, so our nurse practitioners and our PAs really helping out with the call burden as well. So that has been very helpful in terms of managing our wellness and our sleep habits and things like that. So that I would say would be kind of summing up the junior call. We are, for chief call, we're on call pretty much every other week at county and at Northwestern. We obviously don't go to Lurie for the call service, so that's not really a part of the chief call rotation. Otherwise, it can get pretty busy. I would say Northwestern and Lurie tend to be quite busy when you're on call. County is sort of a hit or miss. Sometimes you have a quiet night. Sometimes you can be, in the hospital, sometimes in the OR overnight. I would say one of the real highlights of our program is that our residents really try to take care of one another. I think that people, when there is a very busy call night or something, our junior and senior residents really work well together to try and ensure that the junior resident is allowed to go home and get some rest. So I do think that's definitely a plus of our program is that sort of flexibility and that level of care that we have for each other. So let's move on. I want to talk a little bit about how our teaching philosophy is at Northwestern, Lurie, and County. So Paris, why don't you talk a little bit about what the teaching sort of style is at County versus at Lurie versus at Northwestern? Are you working mostly with attendings, with residents, fellows, a mix?
Yeah, so I think we get a pretty good mixture at all places. I would say definitely at county, you're learning more from your chief resident, going directly to them. Our attendings are always there in clinic, but I find myself going to my chief resident first. And I think that, Abitha, you can talk a little bit more about this, but I think that also really helps the chief resident kind of develop plans and act sort of as an attending. And I think at NMH is probably a mixture of learning from your residents versus your attendings. We do have grand rounds every week. During some of those weeks we have cochlea, and so we're kind of learning from the residents with an attending facultator at that time. And then at Lurie's, I think a good amount of the learning comes from the attendings, because you are working one-on-one with them. So you're kind of formulating your plans, doing all your research, and then you're going directly to your attending and staffing, and then they're kind of making corrections as needed.
All right, so we can move on to our next topic, which is one of my favorites, certainly to highlight, because everybody here is awesome, and I think definitely your co-residents make your resident experience. So Sneha, if you want to tell us sort of what our general resident culture is like in terms of, where are people from? Are we a diverse group of people?
Mm-hmm. Yeah, so I think that there are a really wide range of residents we have a good mix of people from all over the country. I think we're probably a little bit disproportionately more representative of Midwest, but we have people from all over the country, including like Karina from California. One of our interns this year is international from Egypt. So really from all over. I think there are a fair number of people who are like me who may have gone to the East Coast or elsewhere for college and then come back close to home, Midwest for residency. So we're really like geographically pretty diverse, I would say. I think probably like the thing that drew me to this program the most and why I was so happy to stay here was that was really the residents. Everyone is just so fun to be around in our program. It's a really close-knit community, I would say. There's not so much a hierarchy as just like the junior and senior residents it's a very like, open communication between us, and we're all friends outside of the hospital. Like Avitha was my four when I was on Purple last year and is my chief now. And we love to work out together and hang out outside of work. And even though she's my boss at work, we're friends outside of the hospital. And I feel like every day I'm going to work and just hanging out with my friends, which is one of the awesome parts of our program.
I feel the same way, Sneha, except when I make you walk up 10 flights of stairs.
What?
No, I'm just kidding.
Oh,
It's gonna
Don't worry, she didn't pay me to say any of this.
We got to get Paris and Karina in on our workouts too. Paris is, I think, lifting more weight than I could
Paris
ever handle.
is much more intense than I am. Oh my God.
Nico, we got to get you in on it too. Anything else, Paris? Do you want to add anything else about, like, do we hang out outside of the hospital? What's the culture like? If you want to mention anything else about the diversity, I know we're geographically diverse, but I believe we're also pretty culturally and racially diverse as well.
Yeah, I totally agree. I mean, we have people from different ethnicities, and I mean, I think that coming from like being a minority, it's something that you think about when you come to a program, and it's honestly not something that I have to think about on a day-to-day basis. I don't get treated any differently because of that. Everyone is really nice, and it also is just nice to see people from different ethnic backgrounds and everyone just respecting each other's cultures. In terms of just like relationship with other residents, it's amazing. As Sneha mentioned, we all hang out. Pre-COVID, we were having various gatherings like for Thanksgiving and Christmas. We do a yearly gift exchange. Maybe we can do a COVID-friendly one this year, who knows? But yeah, and also just to mention our relationship with our faculty, I think that it's also great. I mean, there is some level of formality. We don't really call them on their first name basis, but I think that we all have a good relationship with them. You know, in the OR, we're talking to them about the case, and then in between that, it's like, you know, how was your weekend? How are your kids? And they really care about us. We care about them, and it's a great working relationship.
Yeah, absolutely. Thanks for mentioning the faculty relationships as well. Actually, we, to kind of jump to that too, you know, one of the things I've noticed over the years here is we do have this, you know, we don't call them by their first names. We call them Dr. So-and-so. And I think that does lead to a level of professional kind of relationship, and which is great. I do think as well, though, there is this opportunity for us to spend time with them outside of the hospital, and I've really enjoyed that. You know, some of the examples include we go to happy hours with a bunch of our attendings at the end of the year, and different attendings actually facilitate different happy hours, and that's great. One of our head and neck attendings has us over at his house for Christmas every year, and he like has this big Indian feast, which is great, and his family is there. It's really fun. One of our facial plastics attendings has us over on his yacht pretty frequently. I think it's like a couple times a year when COVID is not an issue. And that really is kind of a treat for us. We also have an attending who hosts a tennis tournament every year, which is great. And that's also really fun. We used to call it the Cutthroat. I believe it was called the Cutthroat Tournament one year.
What? I never heard that.
No, yeah, that was my, I think that was my intern year or my second year. It was a pretty clever name. But yeah, that's also really fun. All the attendings come. One of our attendings, we go to his house. We've gone to his house a couple different times and just enjoyed food at his place. One of our other attendings has a lake house that she sometimes invites us to. So yeah, I mean, I think there is definitely an opportunity for us to hang out with the attendings and the faculty outside of work. And that has been definitely a rewarding part of our relationship too. If you guys anyone wanted to add anything else about our relationship with the faculty, feel free to chime in. Yeah, Nico.
Yeah, I was just going to say in general, like, yeah, during my experience, just because of COVID times, like I've seen them a little less outside of work, but during work, like even as an intern, I felt like they've been, you know, good to work with. I'm slow and inefficient just getting started, but they'll like, they give me the time to take my time to see patients, present to them, let them know, give them my plan, and based on what I've read and seen. And I felt like in general, like they're very supportive, gave me time to ask questions, and then we're just like, cool to hang out with. I think the clinic environment in general is friendly. There's the attendings that you're working with. There's PAs and NPs that we work with as well that are very friendly. That just make it like a good environment to like work and learn in. So even as I mentioned, even though I haven't had a chance to do too much of them outside of work, it's fun that you're here. I don't feel like it's not like going to a job like like you hear somebody that works like a 9 to 5 and they're like, oh God, I gotta work with Becky again or something like that. Like it's
Great. So let's see, we have a few more things that I think we should touch on real quick. So one of which, I think, Karina, why don't you talk a little bit about our fellows? Like how many fellows do we have? What's the interaction like? And, do they add to our experience? Do they take away from our experience?
Yeah. So we have fellows currently in head and neck. We have one fellow facial plastics, one fellow rhinology, one fellow, and then at children's 2 fellows. Overall, I would say they're definitely an additive, to our add to our learning experience. Let's see. The interaction, depends obviously on the subspecialty, but overall, I don't think it's ever like a competitive relationship. I think they all try to, in addition to obviously they need their fellowship learning experiences, but they try to serve as teachers for us too. At Lurie, I'll say they run the service and they basically act sort of as chiefs of the service. In terms of rhinology, if you listen to our sort of our faculty open house, I think Dr. Welch does a good job of summarizing the relationship there. Since, the chief and the fellow are somewhat close in terms of the, cases and experiences that they would like, typically they're not really taking cases away from each other because the chief will be on, because we have such a sort of diverse array of rhinology faculty, what the fellows will be working with one faculty while the chief will be sort of manning the other faculty's cases. Then let's see, in terms of facial plastics, I think one of the great parts of the facial plastics fellow is that they can actually book their own cases and from their own clinic, so they can take us through trauma cases and sometimes cosmetic stuff as well. And then in head and neck, again, I think they're Camille this year, working with her, she's been really awesome, willing to teach, and certainly not wanting to take any of our learning experiences away from us.
Yeah, absolutely. I would totally agree with all of that stuff. I think that it's really been an additive experience. It really sometimes, like if you especially are a junior resident and maybe feel a little intimidated to work with an attending, for the first or second time or something like that, the fellows are such a great buffer to be able to kind of help teach us, especially teach our junior residents. And then as a senior resident, I think they also do have this kind of additive effect where you kind of get to work together and you see someone from usually a different institution who can actually teach you things from their institution. So you kind of get this added benefit of seeing things from outside of within our own program. And I think that experience alone is very valuable for working with the fellows. So I definitely think like above everything, it's been a very additive experience to our residency. I think we can move on to didactics.
Yeah. So I can just touch really quickly on what our didactic schedules is like. I think overall it's a pretty comprehensive didactics program. We typically, how it goes is that every Friday we usually have a grand rounds followed by a resident didactic. And grand rounds are nice. We get speakers from various different otolaryngology, departments, and it's nice to see how things are done at other places. And then sometimes we'll have sort of multidisciplinary speakers from our own institutions. Cool to see, how allergists contribute to our management of, like, for example, chronic sinusitis patients. And then Cochlea is a nice sort of resident run didactic. and basically we all kind of take ownership of it and teach each other, various fundamental topics in otolaryngology, but we always have a faculty facilitator there in case they can add something from their clinical experience or have other insights that we might not. And then in terms of, we also have a nice array of like additive didactic experiences as well. In particular, to highlight, Dr. Welch from rhinology does a once a month wine plus various rhinology topic lecture, which is also always really fun. And then similarly, Dr. Thomas has, since he started here a couple years ago, has started up a once a month facial plastics lecture, which is nice to give us a little bit more depth in our sort of facial plastics curriculum. And then I think, again, Chicago is also a great place to train just because we have so many sort of adjunctive didactic experiences from other institutions as well that often our faculty will participate in. Just one of the ones that comes to mind is the North Shore Sinus course, where we get to do sort of sinus and skull-based surgery and practice on fresh cadaver heads, which is awesome. Dr. Welch is really involved in planning and teaching that.
Yeah, we also have various temporal bone and skull-based labs. So we do get some extra otology experience too. I'm not sure what's going to happen during like COVID times, but in general, I think the conferences, the citywide conferences are great. We also have something called CLNO, which is a citywide conference where we have didactics. I think it's like 6 months out of the year, and it's great. We have like, basically they take you to a kind of fancy location and they host people from all over the country to come and talk to us about various topics. And they feed you, and there's an open bar, and there's also at the end of the year a resident research competition in which you can win some money. And some of our residents over the last couple of years have been have won some money from that experience. So it's really been, it's not just street cred, but it's also a great experience to be able to meet attendings from outside of Chicago as well. One of the other things I wanted to mention as well was our program does subsidize Board Vitals, which is a question bank. It's similar to like the UWorld of step 1, step 2. So we do get this big question bank to be able to study from for our yearly in-service exams, as well as our board exam after we're done with residency. And then we also get access to Academy U. I think they're changing the name of that, but it's on the Academy's website, Academy for ENT. And they have webcasts from many old meetings from the previous year, so you can watch webcasts, which are very informative. They also have their own set of questions, and now they started an entirely new didactics platform called Flex, where they focus on different topics, and they have podcasts and videos and PowerPoints, I believe. Karina has started to kind of look through those. But yeah, I mean, the opportunities for learning are endless. A lot of it is self-directed, but we also do have sort of learning within our residency program as well, kind of like Karina highlighted. Why don't we move on, talk a little bit about research. Maybe we can have, Nico, I don't know if you've done any projects within, I mean, you just started, so I'm not sure whether you would have any projects that you've already started doing, but Paris, why don't you kind of, since you're on the research block right now, talk about, what is the research block like? You kind of mentioned this, but how did you get started on your project? What sorts of projects are you working on or thinking about working on? And then we can go from there. Maybe each of us can just quickly discuss the types of projects that we've worked on.
Yeah, so as I mentioned before, it's kind of self-directed. We do have a couple of people over at Northwestern who are kind of overseeing the different research projects, and they can put you in touch with attendings. I personally just reached out to Dr. Lavin over at Lurie's. Lurie's has a ton of research going on as well. So I'm currently starting up a retrospective chart review project with Dr. Lavin, and then also working on another project with our incoming facial plastics fellow, James, for next year. So have a couple things going on, again, self-directed, but we have statisticians, we have different people who can help you with different parts of the research block. And again, it's 4 months. So we have a good amount of time to work on those things.
Yeah. So very briefly, I also mostly did clinical research. One of I worked with Dr. Smith on my primary project that I'm continuing to work on is clinical outcomes of sinonasal fungal balls. She's actually a wonderful mentor to work with and has a lot of background and interest in clinical outcomes research. In fact, I think she is the adjunct faculty as well in the Northwestern Center for Public Health and sort of outcomes research. So through that, and we also have really great resources for our own research, including a big clinical database called EDW. It's so nice to not have to like roam around through the charts and like pull out things, and they'll give you, basically you tell them what parameters you want, they give you, like spit it out on a nice spreadsheet. And then access to sort of biostatisticians and other sort of research resources as well.
Yeah, I think my experience so far, I'm kind of starting to wrap up all the projects that I've started, anything that was kind of left over throughout my residency, but it has been, I've really had, I feel like, a variety of different experiences. I felt like I started off with research in pediatrics. I am doing a PEDS ENT fellowship, like I mentioned, so that is kind of my interest and my focus, but it's also very easy to be able to reach out to and also be offered to be involved with the pediatric ENT project. So starting off with like simple case series, I did a case report as well. Then I started working with Dr. Rastetter, who does he works with our pediatric surgery team as well on thyroid. We have like a thyroid consortium where we have both the pediatric endocrinologists and the pediatric surgery team helping us. We meet once a month. I try to make it when I can. I was more frequently able to make it during my research time, but we basically like come up with different project ideas, or our attendings come up with different project ideas. They're open to hearing anything, and they're all focused on pediatric thyroid disease. So I've had like 3 projects come out of that already. One of which is a multi-institutional study that I'm working primarily with Dr. Rastetter on, looking at outcomes of patients who have multifocal disease and looking at the nodal yield when you do a neck dissection for thyroid cancer, for pediatric thyroid cancer. I also did a systematic review. I got to work closely with a med student. That was a great experience. I learned a lot about how to actually perform systematic reviews. So that it alone was a really rewarding kind of opportunity, and something I'll be able to do in my future because of that. That was more based on perioperative management of hypocalcemia in thyroid after thyroid surgery. Then, some of the other things we've worked on, we looked at, ICU utilization within thyroid surgery based off of what type of surgeon does the procedure. So that was also a pretty interesting study and something that I got to get some database experience with. That was my first time kind of working on a larger database. And so that also has been kind of a useful tool that I'll take into my career. The other thing I would say too, I did, I spent my 4 months of research primarily working with one of our attendings, Dr. Tan, who he has many different NIH grants, including, I think it's 2, he now has 2 R01 grants, I believe. So he is very busy in terms of his research, and there's no like shortage of people who can get involved with that with his research opportunities. And so I did work with him on outcomes of patients who've had sinus surgery, kind of predicting, with trying to figure out a model for trying to predict like which patients would do well and which patients would not do as well after sinus surgery. So all of those things have been like, those are just some of the examples. I think there's more that I haven't even mentioned, but I think the variety of experience has been really wonderful throughout. You can do research with our head and neck attendings, with our sinus attendings, and pediatric attendings. I mean, you can really work with anybody, and I think that's wonderful. And people are very receptive to an idea that you might have, and can help you get the resources to actually answer those questions. Sneha and Nico, if you guys have anything you wanted to add about your research experiences. Nico, I know you're pretty new. Sneha, I don't know if you've gotten to work on anything so far.
Yeah, I think you guys gave a good summary. I think if you show an interest and have an idea, all of the attendings are really receptive to starting projects.
Last thing. Yeah. So I think in this next topic, we already sort of touched on talking about sort of how our resident culture is, but the topic of work-life balance and sort of outside opportunities at Northwestern. Sneha, maybe since I feel like PGY2 is probably at most programs the busiest here, do you have time to pursue outside interests?
Yeah, definitely. So I would say my interests are very different. Like during summer and the winter, during summertime, I love to spend time outside, and we're right on the lake. You definitely get time to do that. Even second year when you start taking call. So running, biking on the lake, outdoors is really nice. Even though it's November right now, it's 70 degrees outside, so it's not always cold in Chicago. And other than that, like second year, you are busier, you are taking call, but you still have the majority of weekends off. For example, I'm on call tonight, but I'm off this weekend. So I'll get a couple days off. And you definitely, you have to prioritize your time, and you don't have as much flexibility as intern year, but there's still plenty of time to pursue your other hobbies and interests.
And Beatha, why don't you kind of talk about this? I know you and Cam are amazingly also doing a MBA during your residency. So tell us how that's done.
Well, maybe not very graciously, but gracefully, I should say. So there are some amazing opportunities being involved with an institution at Northwestern, just being a part of Northwestern as an institution in residency. I think there are tons of things you can do here if you have interests that are, obviously being a resident, there's enough to do and you're going to be busy enough as it is. But if you have any, other interests, I think that you can really pursue them here. So one of the things is you do have a variety of clinical scholars certificates. It's kind of like a step down from a master's program. It's completely free, and you can get sort of this training in terms of whatever interests you might have. So one of the things I did early on in residency was get a certificate in medical education, because one of my interests is to continue, pursuing an academic career and staying in med ed. And so that was really a great opportunity. One of our other residents did it with me, and we had final projects, and it was really a valuable experience and didn't take up too much of our time. Karina, I know that you did the global health clinical scholar certificate. Obviously with COVID and stuff,
Bolivia didn't really happen, but but it's nice to have a dedicated global health curriculum. Various topics from speakers.
Yeah, absolutely. There's a couple different ones that no one in our program that I know of has done them, but those are opportunities out there too. You can take a look at our website, MAGA's website. Northwestern's GME program is called MAGA, if you wanted to look that up yourself. There is also an opportunity to complete your MBA here. So Kellogg is one of the best business schools in this country, and somehow some of the emergency department residents have facilitated a way for the residents to actually be able to complete their MBA during the course of their training. They give you about 5 years to do it. It's at a discounted price, and it's through the evening and weekend program. Once you get in, you do have fewer requirements, so it's faster to be able to finish the program. But it's also, you get to integrate completely with people who are within the part-time program as well. So I've made a lot of friends outside of residency in Chicago, and that network I think is very valuable. One of the things I'll highlight right now, a course I'm taking, is a device development class. So really what I'm learning is we're basically creating a medical device right now, and I'm working with people from the law school, the med school, the business school, and the McCormick School of Engineering in the Evanston campus. And it's really such an exciting opportunity, a way for you to be able to understand the process of developing a device, but also you get to not only learn about it, but you also go through the process of creating your own device. So I think that is an absolutely unique opportunity that we have here, and something that I will very much hopefully use in my future as well. So I think that's pretty much I think this is a good summary of our program. I don't know if anyone wants to add anything else, but I was thinking we could maybe give everybody a chance to sort of say, what was the best thing about, what's your favorite thing about this program? What do you think, is the best thing about coming here? And then also, what type of person do you think would fit well in our program? So why don't we start, Nico, with you? If you could answer those questions.
So I think I was thinking about this, like coming from, like as I mentioned, I went to college and med school at Michigan, and that's the kind of institution where people like to stay there. I was ready to leave, but I was nervous to go somewhere else, and I just thought that was kind of a unique thing to Michigan. But coming here, as Sneha mentioned, she did med school here and stayed. There are various other people in other programs, ophthalmology and others, that enjoy, like, have been at Northwestern before and stick around because of how great it is. I think that speaks to the friendly environment, the good teaching experience that we get here, and the variety. Like, people know that if they stay here, they'll get a wide range of opportunities, and to see, you know, disease processes they wouldn't see elsewhere, and work with people they like. So I think the culture is something that kind of stuck out to me and something I really enjoyed. In terms of people that I think would do well here, as we've talked about, it's like it's a fun group. It's people who have each other's back. People who aren't don't, you know, we're all, you know, smart, intelligent human beings, but, you know, we don't think too much of ourselves to not be able to help out those that we're working with. So I've always felt very well supported, but still comfortable. So I think if that's something that you would enjoy, I think you'd do well here.
Thank you, Nico. Sneha, I know you had to step out for a second, but if you wanted to answer the same question, basically we're talking about, you know, what is your favorite aspect of the program or the best thing about being at our program? Basically, why should someone come here? And then after that, what kind of person do you feel would do best at this program?
Yeah, so I think we hit a lot of the highlights of our program. Like I mentioned, I think really in any residency program, you want to find a program that you're going to come out as a competent and an exceptional surgeon and clinician. But at the same time, residency is 5 years, and you want to find a place that you're going to enjoy spending time with the people for 5 years. And so I think one of the highlights of this program for me is really the people, both the residents and our attendings. I think the type of person who would fit best in our program is what one of the deans at Northwestern for med school always says, which is be nice, hardworking, and smart, and in that order. And so I think people who do well here are nice, number one, hardworking, always helping each other out, having each other's backs, and lastly, smart, which most people are, but it's the other two things that really make a great resident.
Paris, what do you think?
Yeah, I feel like both Nico and Sneha hit the nail on the head. I really do enjoy our resident and faculty interactions. I mean, it's kind of unfortunate that we can't, you know, interview in person this year, but I think that was just one of the things that really hit home for me when I did interview there, or interview at Northwestern, and just seeing how you all interacted. And I was like, okay, this is somewhere that I could be. Everyone really gets along, and that definitely holds true now that I'm here. Also, just being in Chicago, it really is nice being in a major city, both for the educational opportunities, as we talked about earlier, but both just, you know, there are so many things that we can do for fun as well. And then in terms of the optimal resident, really just being hardworking and nice and humble, especially. This is a hard program. You're gonna, you know, see some complex things, but as long as you can just remain humble and smart, as Sneha had said, then you'll get through it. And yeah.
Thank you. Prina?
I think everybody else has like said everything I wanted to say, but I think the combination is really unparalleled of incredible faculty and co-residents, really depth and breadth in all specialties and in a variety of populations and clinical sites, and an awesome city. I think that combination is what, you know, is what's really unique about being a resident here. And then in terms of, what kind of resident would do best, I think just a resident that's dedicated to each other, to their patients, and to learning. Yeah.
Awesome. Yeah, I mean, it's hard to add anything to what you guys have already said. I think it's one of the things that I was told when I was interviewing was don't mention location as a reason for wanting to go to a program. But to be honest, it's a huge consideration. And Chicago absolutely is a wonderful place to train. There's so much to do here. We have a lot of different hospitals here and lots of training programs. So we have quite a few ENT programs here. So, that also lends itself to collaboration and kind of citywide opportunities that you wouldn't otherwise have. That being said, we have a huge breadth of operative, cases and volume, and a very diverse population in Chicago. So I really feel very well trained here. And I feel ready to kind of move on to the next stages after, having trained here as a resident. That being said, the reason why I really wanted to come here in the first place, and this holds true and has held true throughout my residency experience, is, the people make it what it is. And it definitely is the kind of program where we support each other no matter what. We do have a type of flattened hierarchy, I would say, where obviously, everyone is respectful of each other. We're always open to hearing each other's ideas. We genuinely enjoy spending time with one another. And I think one of the things that I noticed when I first came here was people you spend all day with each other in the hospital, but we still want to spend time with each other outside of the hospital too. And I think that really makes a big difference. And it's not like you feel really pressured to spend time with everybody if you are busy or you have your own thing going on, but everyone is just very welcoming and open, and we have each other at one another's houses, at our weddings, at all of our celebrations. And so, that sort of thing really makes you feel like you've created a community here that will continue to be a community throughout the rest of your life. And so I'm definitely really, I love being able to be at a program like this, and kind of like Paris said too, just where you train makes a difference. Northwestern itself, the hospital, has such a variety of resources that it has just made this training experience easier. It's funny that I talked about the 24-hour Starbucks, but to be honest, that makes a big difference. Sometimes you come in overnight on call and you have to stay here until the morning, and you have a place where you can go get coffee, and not just regular coffee. You can get pumpkin spice lattes if you want to.
This pumpkin cream over here.
I might be drinking one right now. Anyways, yeah, so the type of person I think that would do well here, I think someone who is flexible, who is open-minded, and very willing to learn, but is also very motivated. Someone who is self-motivated especially, I think, would do really well here, because while we have a lot of structure in terms of our training experience, I think we do have the opportunity for people to kind of have self-directed learning as well. So someone who's independent would do a good job, I would say here. Yeah. That's pretty much it. I think we've kind of touched on everything. If no one else has anything that they want to add, thank you guys so much for participating in this. And thank you all to everyone who is watching us. And if you have any questions, please feel free to reach out to us. Trying to think of a way that we can share our contact information. Maybe we'll just go around and say our email addresses or something like that, and that way people can contact us if they want. So you can contact me via Abitha, ABHITA, @northwestern.edu.
Mine is Karina, KARINA.YU @northwestern.edu.
Mine is Paris, like Paris, France, PARIS.Austell, AUSTELL @northwestern.edu.
Mine is Sneha, SNEHA.GIRI @northwestern.edu.
And mine is my full name, Nicolas.Espinoza @northwestern.edu.
All right. Thank you guys for joining us, and hopefully we get to meet you virtually soon.